Hello everyone, I'm Dr. Jung. I'm a board certified dermatologist in Korea and I'm running oral dermatology clinic in Seoul, Korea.
Hello, I'm Dr. Mark McKelvey. I am a medical aesthetic physician based in the Philippines, in Manila, and I run the McKelvey Medical Clinic. And thank you for joining us today. Today we're going to be talking about the Giselleligne range of fillers by CG Bio here in South Korea. And Dr. Jung, if I can start by asking you, firstly, how long have you been using Giselleligne fillers for? And what do you consider to be the most important aspects when thinking about a filler treatment? And why did you choose Giselleligne?
I have been using Giselleligne filler for about 5 years. I think the most important aspect of filler procedures is designing them specifically for each individual patient. Before the procedure, it is crucial to have thorough consultations with patients to understand their desired outcomes and observe their natural facial movements in order to achieve seamless and natural facial contour. To accomplish this, the first step is selecting a safe filler product. In addition, it is essential to choose a filler that allows for predictable results throughout the procedure. Giselleligne, for example, ensures safety with a degree of modification value in the 2% range. It is hydrated sufficiently, resulting in minimal swelling. Its injection force is relatively low and it provides soft boundaries after injection, guaranteeing predictable treatment outcomes.
And I think that's quite important what you're saying about choosing the right patient. It comes down to the consultation, patient understanding the treatment and the benefits and the risks, but also choosing the right product and the right treatment plan. And I think you're absolutely right with what you're saying, is that that's what then achieves the best outcomes. So what are the clinical advantages of the multi-layered properties of Giselleligne?
Giselleligne, being a multi-layered filler, has the ability to withstand muscle movement and recover its original shape elastically. These characteristics minimize migration, meaning the filler stays in place after injection. As a result, it is believed that Giselleligne has a longer duration compared to monophasic fillers. This extended duration implies that the filler remains stable and maintains facial volume for a long period. However, the exact duration of the filler can vary depending on individual biological responses and metabolism rates.
I've certainly found in my practice that it's a predictable and easy to use filler. It's smooth, stays where you want it. And of course, that's one of the most important questions we are always asked: how long will my lips last or my cheeks last? We have the range in front of us and you'll tell us a little bit more detail about the range, but generally speaking, we're thinking 9 to 12 months for the softer Signature 1, all the way up to maybe 24 months in some cases with the Signature 2 harder filler. So, Dr. Jung, what are the biggest differences between the biphasic and the multi-layered fillers?
Biphasic fillers have particle-based structures resembling grains of sand. On the other hand, multi-layered fillers created using large-scale technology combine monophasic and biphasic components, where the monophasic components encapsulate the biphasic component. As a result, these multi-layered fillers have the advantage of biphasic filler, such as excellent sculpting capabilities and smooth boundaries after injection, similar to monophasic fillers.
And that's what I've noticed in my practice as well. There's a nice extrusion force for the filler, so it's not too hard, it's not too easy. I completely agree with the smoothness of the filler that you talk about. And of course, it's very important with some procedures to be able to mold the filler. And I found that the Giselleligne fillers have that pliability that makes it easy to mold, but it stays in the right place and it has the smooth contours. So yes, I completely agree with that. And of course, we've mentioned how Giselleligne is presented in the 3 lines that sit in front of us. So perhaps, Dr. Jung, you can tell us which products are most suitable for which area of treatment.
Signature 1 filler is suitable for areas with thin skin, such as the lips and under the eyes. On the other hand, Signature 2 filler, with its larger biphasic particles within the multilayer structure, is suitable for areas that require volumization, such as nasolabial fold, nose, or the chin. Universal filler, on the other hand, has a similar elasticity to lateral lift, making it recommended for use in areas like the forehead, temple, or nose. However, in recent procedures, it is considered more efficient to inject fillers that target not only the specific area, but also the appropriate skin layer, and provide the right amount of elasticity. For example, in the case of nasolabial fold correction, injecting Signature 2 filler into the restore space and using Signature 1 filler in the surroundings of dermal layer can improve both deep and superficial wrinkles more naturally. This combination helps achieve more natural results.
And I think that approach, as you describe, where you tackle different layers, is so important in getting a natural result. Like the nasolabial fold, you might think of a deep component, maybe even down to the bone, leaving some boluses of filler, but then you can come more superficially with a softer filler just to fill in more superficial. I think that's really, really important to get that real natural result. And yes, the range, as you've described, covers all those different areas, but I think there is also sometimes a little bit of leeway almost, because yes, I would use Signature 1 in the lips. My experience is that gives a very subtle, gentle volumization to the lips, a hydration almost. But for those that want a more pronounced, volumized, obvious lip treatment, I might use the universal for that. So there's a little bit of a crossover, I find as well. So Dr. Jung, what are the most common areas of treatment with Giselleligne that you have in your practice, and what are the advantages when Giselleligne is applied in those areas?
Giselleligne is commonly used in areas such as anterior cheek and nasolabial fold in my clinic. These areas often require volume restoration and lifting effects, which Giselleligne provides due to its thicker consistency and higher elasticity. It is designed to provide longer-lasting results, making it suitable for areas that require significant volume enhancement. The anterior cheek is a common area for volume loss with aging, and Giselleligne can help restore the useful fullness in this region. The nasolabial fold, which is the deep line that runs from the side of the nose to the corner of the mouth, can also benefit from Giselleligne injections to smooth out the wrinkle and restore a useful appearance. It is important to consult with qualified medical professional to determine the most appropriate treatment plan and ensure the best results for your specific needs.
And I think that's one of the most important things to echo, is that for those that are wanting to seek these treatments, is that it is a medical procedure. There are risks associated with any of these filler procedures, so it's so important to see someone appropriately trained and qualified to do that treatment. In my practice, similarly to yours, nasolabial folds, chins, some lips, cheeks are the most common things that I tend to be asked to do. Temple treatments as well. And certainly the range that's provided allows me to cover all of that and use the right filler in the right place, which is what we were talking about. So thank you very much for that very helpful discussion, and I hope you found that very informative as well. Thank you very much for joining us, and we hope to see you again soon for another discussion in the near future. Thank you.
Thank you.